Hi, everyone. Welcome to our webinar today. I'm so excited to have the chance to speak with you all about my life and my specialty. So my name is Sana. I am a PGY2 radiology resident. I have been with MSP for 4+ years now and have had a great time as a tutor, as a residency consultant. So I'm happy to share a little bit with you all today about why I chose radiology and why I chose this specialty. A little bit more background on myself. I went to UMass for medical school and I graduated in 2019. I spent my prelim year doing a year in internal medicine last year, and then I started radiology residency at Brigham this past July. So I'm a PGY2, but R1. So I'm happy to sort of walk you through some of why I chose radiology, why radiology is the best specialty, and what it sort of looks like to be a radiologist day in and day out. Just very briefly, a little bit about who we are at Med School Tutors. So we are a one-on-one online tutoring company, and we have been tutoring for many years. We tutor pre-meds, we tutor students in medical school for their board exams, we tutor in residency for the Step 3 exam, and further. And so we have really the whole gambit. And we have tutors who are medical students, and we have tutors all the way through being attending. So great teachers in pretty much every specialty and pretty much all over the country. So great group of people. And we're excited to share some of that knowledge with you today. So what I'll start with is a little bit about why I went into medicine, and then specifically why I went into radiology. So I went into undergrad really with the idea that I might be interested in medicine. I knew that I was going to major in the science field. I ended up majoring in biochemistry. And I was really, with that degree, I wanted to have, a stable job was something that was very important to me. So I wanted to be in a field where I would have job stability, job security, and be able to have a good living. And it was also important to me to really apply my knowledge into something useful, and to be able to use all the science and biochemistry into something that would become clinically useful. I always, or not just clinically, but useful in general. I think that one thing I always struggled with in high school and even in some of my undergraduate classes was when I was reading some of the, English literature that I was reading was, how am I going to use this moving forward? And so utility was something that was very important to me. And I ended up choosing medicine by shadowing a bunch of physicians in a bunch of different fields, including primary care, surgery, just emergency medicine, not radiology, had no idea about radiology, but sort of getting a lot of exposure and deciding, okay, I could see myself doing this. I could see myself taking care of patients and being a part of the medical field. And I think it felt like a worthy place for me to really spend my time. And so I think it wasn't really, I didn't really have a come to Jesus moment or anything like that. It was more just a sort of strategic process of, this is what my interests are, what are the careers within that, and then exploring a lot of those different careers. I also spent a lot of time in research labs, seeing if a PhD would be something of interest to me in sort of the corporate setting, and seeing, okay, would I be interested in, research and development for like a company? But the thing that felt the most immediately gratifying to me was patient care. And so that was why I chose medicine. And I imagine that that's probably why a lot of you chose and are choosing medicine moving forward. So I went into medical school sort of thinking maybe internal medicine, maybe some subspecialty off of that. And the first 2 years of medical school, you don't unfortunately get a lot of great exposure to the different subspecialties. It's mostly preclinical medicine. So what I found was I really, really loved the first 2 years of medical school. I loved learning anatomy, physiology, all of the pathophysiology. I actually really enjoyed studying for Step 1, apart from the stress of it, just because I felt like I was really applying my knowledge and that everything was coming together. Things felt cohesive. I felt like I was doing all of the studying and that it had a direct application into, so like I said, that sort of similar theme of, all of the stuff I'm learning has a point. I'm using it in my future practice. And so I really loved the first 2 years of medical school. Then I went into third year of med school, hoping to really love internal medicine. And so I spent some time on surgery and I liked it, but I didn't love the lifestyle of being in the hospital all the time, really spending brutal hours in the OR and having to be in a very high stress environment. It just wasn't conducive to me. So I said, okay, well, I don't think I'm a surgeon. I don't think that that's the right career path for me. Then after that, I went to OBGYN. Similar idea. It's still a lot of surgical work, and a very specific population. And I wanted to see more. I felt like there was all of this world of medicine that I had learned about, and it wasn't being applied in just OBGYN. So it wasn't enough for me. And then I went to internal medicine, and what I was expecting to really love the rotation, but what I found was that the part of medicine that really interested me the most was diagnostics. I love to figure out and solve the puzzle of what's going on. Like I see this lab value and this imaging finding and this presentation and these symptoms, and how do I piece it all together and create a diagnosis? That was the part that was fun for me. That was the part that I enjoyed. That was the part that I really could spend hours doing and didn't find myself frustrated or find myself getting burnt out in any way by that work. What I did not enjoy as much was the day-to-day management of medicine, the day-to-day of choosing antibiotics and choosing fluids and choosing diuretics, and all of those decision points were not nearly as gratifying to me as that initial workup, that excitement of figuring out what's going on, and that application of this very wide breadth of knowledge. So I left medicine thinking, okay, this could work, but it's not necessarily the best fit, and I don't find myself loving it in the way that I hoped I would. And then I went to outpatient medicine, and it was sort of a very similar feeling: pediatrics, psychiatry, family medicine. I did all of those rotations and just felt like something was missing. Nothing was striking me as this is my calling. I have to do this. This is where all of my energy goes. And so radiology, I happened upon in a 1-week elective that my medical school offered us 1-week electives in different subspecialties if we didn't have a chance to see them otherwise. And I chose radiology, to be perfectly honest, because I heard it was a pretty relaxed week. And then I did my rotation and I found, oh, wow, like this is all of the parts of medicine that I had loved in one specialty. And what I mean by that is that all of the diagnostics, all of the figuring out what's going on, the complex pieces, putting it all together, all the radiologists do that. And I know that some people may have the misconception that we're just looking at the pictures, but 99% of the time, I'm looking up what labs they have. I'm looking up the symptoms. I'm looking at that whole picture and trying to piece together a story as to why does this person have these findings? Why does this person have these symptoms? And can I make that match with what I'm seeing on the imaging? So I love that sort of detective work and that puzzle pieces aspect of being a radiologist. And then what I'll also say is that the breadth of knowledge that I found in all of the radiologists was so impressive to me. Every radiologist knew diagnosis that I had never even heard of, and knew the very specific pathophysiology of those diagnoses. And that was really impressive to me. And that was what I had always loved about medicine, is knowing all of this, having this incredible breadth of knowledge, spending all of these years of studying and actually being able to apply it, actually applying it every single day to the work that you do. And I think that that was something that was always important to me and really brought me joy. And so I spent a few more months on that during my 4th year, and I actually didn't decide to apply into radiology until just a few months before the deadline and when we had to submit our applications. So it was a very circuitous journey, and now that I'm here, now that I've been doing it for, I think, 9 months now, I could not be happier with the choice that I made, because I think that all of those reasons are the perfect reasons to go into it, because those are the things that keep me coming back to work every single day and keep me very happy at work every single day. So more broadly, why radiology for most people? So like I said, the diversity of cases, really seeing every single different type of pathology that exists. And just by seeing such a high volume, we see so many cases every single day, especially at big academic centers. that you see everything. I have seen diseases that I had never even heard of before. I've seen diseases that I had only read about in textbooks. So being able to see that, just even as a first year, is really incredible. And it feels like all of that studying has, come to fruition. It was actually useful. The critical thinking, the application of knowledge sort of dovetails with that too. Just using every single data point at your disposal, looking at the clinical history, looking at the labs, and pulling it all together to create a cohesive picture. You really feel like the doctor's doctor is the classic term that's been used to describe radiologists. Is you really work with all of the other clinicians to help form a cohesive picture, and a lot of your work is with other clinicians, with other people trying to solve a puzzle. And I always loved that. That was what made me feel like a doctor. That critical thinking was what made me feel like, oh, I'm doing this. And so that I think has been incredibly gratifying as well. I'll also say the autonomy and flexibility afforded to you in radiology is unlike any other specialty in medicine. So these were sort of cherries on top of everything else that was great about radiology for me, was that you can work as much or as little as you want to. You can have as much or as little patient contact as you want to. There are very, very varied subspecialties within radiology. If you're interested in a lot of patient contact, if you really want to spend time with patients, there's always IR, there's always mammography, there's always MSK radiology, where you're doing lots and lots of procedures, where you're interacting with patients every single day. There's a huge subset of radiology that has a significant amount of patient contact. If you don't want as much patient contact, pick a specialty like the emergency department or other specialties with decreased number of procedures. That is also available to you. If you want to work 5 days a week, if you want to work 2 days a week, these are all very, very easy. And it's much more amenable to shift work, which is that there aren't really radiologic emergencies, and the people on call will cover that, versus you really have the opportunity to spend that time not at work, and really truly be off, which allows you to, and something that was very important to me is to have a great work-life balance. And I think that the radiologists have that more than anyone that I had ever seen in the hospital. Just the real ability to spend your time at work, working very, very hard with your brain on all day, 24/7, or not 24/7, however many hours you're there. And then once you go home, to have that time and to have as much time as you want, as much or as little as you feel like is needed for you, to be flexible and to have that life. So I think that those were all things that were very important to me. And that was a big part of why I chose radiology. And so I'll speak a little bit also about residency and what radiology residency is like, and how it differs from some of the others. So radiology, as I mentioned, after medical school, you do one intern year, and that is either in medicine or surgery or a transitional program, and then 4 years of radiology. So I completed my intern year in internal medicine. So I did almost a completely traditional medicine intern year for that. I'll say if I were to hazard a guess, I would say 30 to 35% of radiology residents end up doing a classic medicine intern year, maybe about 30 to 35 again, maybe a little more, maybe 40% spend it doing a transitional year program, which is integrate a little bit of surgery, a little bit of medicine, a little bit of everything. And then some choose to do a surgical intern year, though that is predominantly in people who are interested in procedural subspecialties afterwards. They may choose to sort of sharpen their surgical and procedural skills during that year. And then 4 years of radiology, and those are sort of separate application processes. Most people do a fellowship before starting as an attending, and almost all fellowships are 1 year long. And so in total, it ends up being, after you graduate medical school, 6 years to being an attending, which is pretty on par with most specialties. For example, orthopedic surgery, 5 years of residency, most people do a fellowship. So about 6 or 7 years. Internal medicine, 3 years of residency, and then 3 years for most fellowships, so 6 years. So pretty on par with most residency fellowship combinations before becoming an attending. And I'll say that as far as the residency goes, your first year of radiology residency is very, very flexible because radiology is such a field that people really don't get much exposure to during medical school. And the skills you learn in medical school, though the pathophysiology is important, you don't spend a lot of time looking at images. So a lot of that time is used for studying. So in radiology residency, I spend probably from 8 to 5, I'm at work, and then that's it. I have all nights off, I have all weekends off, all holidays off as a first year resident. And the rest of that time is sort of expected that I'll be going home and studying for, an hour, 2 hours every day to sort of supplement that knowledge and to build that knowledge foundation. Second year, you take a little bit of call. Third year, you take a little bit of call, but probably about 1 to 2 months total of call between those 2 years. So not significant. And then fourth year, there's much less call, and you're almost back to a first year schedule of having most weekends, most nights off. So it's a very, very flexible residency as compared to probably most other residencies. It's certainly not as rigorous as a surgical residency or an internal medicine residency. I can guarantee you that. But there's a lot of outside of work time that's spent studying because it's just a very different skill set, and to make sure you get exposure to things that you might just not see every day in your cases. And then as far as my day-to-day, this is something I get asked a lot as a resident, is what do your days actually look like? So most residencies, and so I'll speak for my residency. So I'm at Brigham and Women's, and most residencies follow a similar structure, but maybe a little bit of tweaks here and there. So every morning we have an AM conference from 7:45 to 8:15 AM. So I get into work at 7:45. And for that half hour, we have a morning conference, and we talk about various sort of topics in radiology for that. Usually we have attendings lecture us for those. 8:30, I get to the reading room, and 8:30 to noon, you're doing reading and procedures. And so what that looks like is we usually are reading CTs, X-rays, MRIs once you're a little bit more advanced, and going through them. And every probably hour to 2 hours, we'll read out with an attending and review our cases. So I'll just pick up cases and start reading, and then review every so often with my attending to go through the cases. If we have procedures, then I'll be doing those with the attending as well. So radiology is a little bit different than most specialties because you're spending a lot more one-on-one time with the attendings as opposed to working in teams of other residents. I don't work as often with my other co-residents as I do in other specialties, for example. And then so 12:15 to 1:15, lunch conference. So similar as that morning conference, we have an hour, we eat lunch, we have a lecture. And then 1:30 to 5, similar idea. So pretty similar structure every day. And then again, like I mentioned, I go home and then I'll do 1 to 2 hours of reading, but the rest of the time is really yours, which is very, very nice compared to a lot of the other subspecialties. So in general, I will say that it's a different schedule than most residencies, like I said, because of that outside of work studying that happens. But I personally have found this much more conducive to what I enjoy and the parts of medicine that I like. But it really just depends what you prioritize. And so I'll briefly touch a little bit about what we do at MST, but I'm going to get to all of these questions here soon as well. So I would love for all of you to filter in your questions and let me know what else you wanted us to talk about. But briefly, so Med School Tutors, we're an online tutoring company. We do a lot of the tutoring for different exams and studying schedules. And so we have one-on-one tutors and from all over the world, all over the country, to customize to what your needs are, whether that be didactic or not. And we have, as I mentioned, radiology residents, derm residents, ENT residents, we've got everything. So I think that's really important because we have a little bit of knowledge about everything. And so any questions you have, please feel free to reach out to us. We're happy to address. And so with that, I will love to get into some of the questions we have. So the first question I'm seeing is, what specialty are you most interested in? And how much do you know specifically about MSK radiology? So great question. So I am, as a first year, I'm undecided at this moment. So I'm fairly certain that I will not be going into interventional radiology because the amount of procedures in IR is almost purely procedure driven and not as much diagnostic reading. And I really do enjoy that part of radiology as well. So I don't think I'd be able to give up my reading side. So not IR. As far as other specialties in radiology, so the specialties are pretty varied. So breast, for example, has probably one of the highest amount of patient contact because patients will come in for their screening mammograms and you're reading those immediately and saying, okay, I need these additional views, this additional image, blah, blah, blah. And any sort of biopsies that you do, you're doing in real time. So breast mammographers have a significant amount of patient interaction and procedures. I would say most of them probably spend 2 or 3 days a week purely doing procedures and interacting with patients, and maybe 1 day a week doing just reading plain, no patient contact. MSK radiology, usually they spend, at least at my institution, so I can speak to what we do at Brigham, I can't speak to everywhere. We do quite a few procedures in our MSK division, all arthrograms, all sort of joint aspirations, all sort of several soft tissue biopsies, etc. Those are done by our MSK division. What I'll say is the attendings, their typical schedule is they'll spend maybe 1 to 2 days just reading plain films, MRIs, going through those studies. They'll spend 1 to 2 days a week doing procedures at one site or another. And some of those sites are simply arthrograms, so simply sort of short, quick procedures. And sometimes they're the more extensive biopsies and elaborate procedures on another day, perhaps. And then sometimes again, at Brigham, we have a lot more faculty who have administrative time, et cetera. So maybe 1 day of like admin time and doing other tasks. So I would say there's as much patient contact as you would like in MSK. Probably most people spend about 40 to 50% of their time doing procedures with patients, at Brigham at least. But I think that it depends on your practice. It depends where you go. And what I'll also say is the more procedures you do, the more marketable you are moving forward. Everyone that I've spoken to says if there's a sort of a divide between private practice radiology and academic radiology. And if you do procedures, private practices definitely want you because that for billable hours, et cetera. There's something to do with the billing that I know less about, but it's certainly, if you want procedures, there's definitely no dearth of procedures if you're interested. All right, great. So I have another question here that says, my question is, when did you start applying for research positions to bolster your CV for radiology residency? So this is a great question. So like I said, I actually didn't decide I was interested in radiology until fairly late in the game. So again, I started to think about radiology maybe in my late third year, and then didn't really make my decision until July of my fourth year. And as some of you may know, applications are due in September, so it was kind of late in the game. What I will say is I was very, very focused on making sure my application was good before that point for whatever I applied into. So I participated in a lot of things that were important to me, not just to bolster my application, but also just to be involved and engaged and show the things that I cared about. So for example, I was student body president because that was something that was really important to me. And I think that certainly helps my application down the road to demonstrate leadership. I had worked on a couple of other research projects, mostly in internal medicine, because that is what I had been intending to go into. But I still think that demonstrated an interest in research. And I told my story honestly. I said, look, I thought I was going to go into IM. I thought for a long time that this was going to be my path. I didn't find radiology until fairly late in the game. So I think I had one radiology research project on my CV by the time I submitted my application. And that one I had picked up probably 2-3 months before I had to actually submit my application. So fairly late in the game. But I tried to strengthen my application as soon as I started med school with other things. with other projects that I was interested in, with other opportunities, with other committees, etc. Not necessarily radiology focused. And one thing I will say about radiology is that they care a lot about demonstrating strengths across other disciplines, because it's really hard to demonstrate radiology interest as a medical student. You're not going to know how to read scans. And honestly, you're going to learn that during residency, and you can't really demonstrate it as a medical student. So what's important to residencies is that you're going to work hard, you're going to demonstrate that you go home and you study, and that you're putting in effort. And you can demonstrate all of those things on medicine, on surgery, on any number of other things. If you just have good letter writers and are showing that in the other parts of your application, then it doesn't have to be radiology specific. It really just has to demonstrate sort of character traits more than it does radiology has been my passion since the day I was born, because they know most medical schools don't have great exposure, and most people don't find out about it until kind of later in the game. Another great question. So when do you figure out what type of doctor you want to be in medical school? So great question. And as I said, you have plenty of time, because I didn't decide until months before the application was due. I'll say that I was probably a little bit later in the game. Most people figured it out by the middle of the third year of medical school. Most people, after going through 1 or 2 clerkships, maybe a little bit later, decided, okay, this is what I'm interested in. And some people had an idea beforehand. Some people came in day 1 and knew. Some people came in and had maybe an idea, and that was confirmed or changed during medical school, like mine was. But most people figure it out third year of med school. And even if you don't, that's okay. I didn't figure it out till 4th year. But I think somehow it always comes together. And what I'll also say is most people would be happy in a variety of different fields. There's not like a perfect fit. There's not a soulmate specialty. At least I don't believe that, people may feel differently. But I think that most people could be happy in a bunch of different things. You just have to find the thing that you're the most happy in, and the thing you could see yourself doing when you're 50 years old. That was a question I kept asking myself throughout this process. Can I see myself doing this when I'm 50? And I think that will help you with that. All right. Okay, so one great question is, are there particular qualities looked for by radiology programs? In general, do you recommend explaining any setbacks in personal statements, or waiting until the interviews? So great question. And so I think I sort of touched on this a little bit before, but I think that what radiology programs are looking for is dedication and hard work, and a commitment to becoming your best self, and a commitment to going home and putting in the work. They want to see that you're willing to go home and study, because that's where radiologists are made. They're made a little bit in the reading room and a little bit in reading lots of cases, but most radiologists are made when they go home and study at night. And they want you to show across all of your other rotations that you're willing to do that you're going home after your medicine clerkship and you're studying, and that you're working really hard to take care of your patients on medicine, and that you have great communication skills with other specialists, and that you're willing to put in the work. And so I think that doing really well on all your clerkships is going to be number one for everybody. Make sure you're working really hard on every rotation, even if you hate it, even if it is the clerkship that you would never, ever go into. That's where it counts, to show that you have the grit and the resilience to still work hard and still put in the effort, I think is the most important thing. So make sure you're showing up every day and putting in your full effort. And then as far as sort of the breakdown of letters and specialties, et cetera, as I mentioned, most people don't know they're going to go into radiology until late in the game. So most programs, I believe there are a few programs who want no more than one letter from a radiologist. The majority of your letters should be from medicine or surgery faculty. So that, again, just goes to show you they really want to see, are you working hard on your medicine clerkship? Are you working hard on your surgery clerkship? Because that is where you're going to show good effort, showing up every day, learning about your patients, and that's what they want to see. Radiology letters, honestly, during most radiology clerkships, you're sitting behind an attending and watching them read studies. You're not demonstrating anything during that time. You're not impressing anybody. And that's okay. You're not expected to. But that's why those medicine and surgery letters are all the more important. I think it's important to demonstrate some level of interest in radiology. So do a rotation or two to prove that you've actually, seen it and decided that you like it. But it's certainly not important to do away rotation. My feeling is I don't think it's necessary to do aways to really demonstrate an interest in radiology. I didn't do any aways in radiology because that's not where you're going to show your skill set. Work hard in the other rotations, get letters from other rotations, and that's where you impress people. And what I'll say is radiology, like people, there are so many different radiologists in the world, and this is a specialty for everyone. I don't think that, I think that there's a lot of opportunities here for patient care, if you're interested in that or not. And then the sort of what your goals are as far as your work-life balance. I think that that's really, really important. But it's a great specialty for everybody. Okay, interesting. So a lot of questions about the future of radiology, machine learning, AI. And the short answer is I don't know as much about this as I wish I did. And this was something that was, in a way, very interesting to me as I first started to apply to radiology, and also concerning because I certainly didn't want to go into a field where I wasn't going to have a job. like I said, what am I going to be doing when I'm 50? I want to still have a job. So I think it's important to be aware of the machine learning and AI. There are constant new innovations. And from the level that I've been at, the research we're doing at Brigham, all of them have been to enhance and further assist radiologists in becoming more efficient. And that has been true across the board. That's the case in mammography with the calcification detection, microcalc. Some people may know that software a little bit. And with protocoling, auto protocols based on the indications, and sort of assistive technology in helping us do our jobs better. As far as my personal knowledge of where the field is going, I don't have a great sense. And I think that is a question for the experts in the field. But what I'll say is none of the radiologists, and I talked to many people across the board when I was applying to radiology about this, no one was concerned about this taking their jobs. And that reassured me that I could feel comfortable applying into this field and that I could feel comfortable that I would have a job in 50 years. But I think that is, I would not trust my opinion on that. I would certainly go to an expert, go to an AI person to talk to them about where they think the future of the field is, because I would be purely speculating, and I don't know enough to be able to answer that, unfortunately. Okay, so a lot of people are asking a little bit about studying and what studying looks like, and how I was motivated to keep studying undergrad and beyond. So I think that I was always very goal driven. So for me, I tried to keep short-term goals in mind. So for example, I tried to keep a big picture of medical school out of my head because it was too abstract of an idea. So I tried to be much more granular in my goals and said, I need to get all of these things done by the end of the month, or I need to get these things done by the end of the week. Like, this is my checklist. This is what I need to do. I need to focus on this, focus on this, focus on this. And in that way, I think that time really passes by much more quickly and that you're able to achieve more. Because if I said, I want to get into medical school, I think that that's much harder to say. And then even to say, like, I want to get all A's, like, it's just not a feasible thing to sort of just tell yourself. So I would really try and create very granular goals and set yourself up that way. And then as far as motivation to study and what studying looks like, so there are a lot of great radiology textbooks. And what I try and do is I come home and I honestly will set a timer, and I'll just say, okay, I'm going to study from now until, so usually my study time is 7 p.m. to 9 p.m. That is when I study. I don't talk to anyone. I just sit down with my books and I study. And most radiology studying there's a little bit of textbook reading, but the vast majority of it is images. So most of the diagnoses you will have heard of already. I know what cholecystitis is. I know what choledocholithiasis is, right? Like, you know these things from medical school, but to see the images and to keep looking at pictures on pictures on pictures, that's what radiology studying is. And there are a lot of great textbooks that give you 18 different pictures of the exact same diagnosis so that you've seen this is what it looks like in this way, in this way, in this modality, in that modality. And I think that's really important. So big fan of that as a studying tool. And I think that that's the best way to do it. All right. Is fellowship mandatory? Fellowship, I don't believe it's mandatory per se, but I will say the vast majority of radiology residents do it. And most private practices certainly would like people who are fellowship trained. And most academic institutions certainly expect you to be fellowship trained if you accept a position there. All right. So I think that is all we have for today. We have a lot of great tutors in, as I mentioned, literally every different specialty that there is. So feel free to reach out to us if you'd like to talk to someone in any specialty that you're thinking about, or any questions that you have about the future of the field and how to decide between two specialties. We would be more than happy to help with all of that. So with that, I will sign off for today. So thank you for joining us, and please feel free to reach out if anything else comes up.